Now, it's all about health. Every year, thousands of people die from rabies, a deadly yet preventable disease due to lack of access to rabies vaccine in time. On this episode of Health Digest, Gloria Milimu looks at why experts are calling for the optimization of human rabies vaccine supply chain as a strategy to dog rabies control and elimination. Take a look.
They are considered a man's best friend, and humans have lived with them for thousands of years. Whereas it's one of the most popular pets world over, unvaccinated dogs remain a public health threat. So much so that their bite results in one of the deadliest diseases that causes at least 59,000 deaths annually in low and middle income countries like Kenya. For people like Faith Akoth, a resident of Bondo in Siaya County who recently suffered a dog bite, accessing timely care through a post-exposure prophylaxis, which often involves wound cleaning, a course of rabies vaccine, and in some cases, injection of immunoglobulin, could mean the difference between life and death. She was bitten by a neighbor's dog.
After kuniuma, tulirudi nyumbani, nikachukua pikipiki. Nikaenda hadi Bondo district. Within 30 minutes nilikuwa nimepewa dawa, nikadungwa sindano la kwanza. After 3 days tena nikarudi Bondo, nikadungwa sindano la pili. Then the following week tena nikarudia sindano ya 3. So after 28 days nilikuwa nidungwe sindano ya 4, wakasema dawa zimeisha. Niende ninunue na 1600.
Unlike her, Gladys Kimbili's mother from Makueni County never survived the bite from a rabid dog. Her case mirrors what thousands go through despite the availability of effective rabies vaccines.
Hiyo mbwa ikikuja ilikuwa na mdomo yake inakuwa inatoka mate. Akaingia hapa kwa mlango. Ndio imeenda kumshikilia hiyo matiti mawili na hapa kwa mkono. Ndio tukakuta hii iko na hiyo ugonjwa.
Many of these deaths, according to a recent study by researchers from the University of Nairobi's Center for Epidemiological Modeling and Analysis, SEMA, in conjunction with other institutions, occurs due to lack of access to timely treatment.
Most of these people that are dying are usually located in underserved communities, where we find that access to vaccines or even healthcare services is usually a challenge.
People do not know the importance of getting rabies vaccine immediately, because that virus moves from the flesh wound into the nerves between 24 to 72 hours, depending on the thickness of the muscles or how deep the nerves were.
Frequent stockouts and high costs of the post-exposure prophylaxis are also some of the barriers identified in the modeling study that evaluated vaccine demand, supply chain challenges, and management strategies using data from Kenya and the neighboring Tanzania.
The major challenge is lack of the vaccine in the facility. But our vaccines also need a cold chain. And some of our health facility does not have a cold chain.
Expanding access to post-exposure prophylaxis for those who need it could save thousands of lives annually, according to experts. This, they say, can be achieved through integrating the human rabies vaccine into the national immunization program. Currently, rabies vaccines don't fall within routine vaccine systems, which are very well maintained in terms of logistics, restocking, and supply.
If these stockouts were actually even put in the system where a hospital would trigger a stockout situation within the whole reporting system, then it will be easy for us to know which facilities we can target for just the supply.
One of the challenges that continues to hamper rabies elimination and control is the fact that once opened, vials cannot be kept overnight. This, in turn, according to the researchers, results in wastage, a common phenomenon witnessed in clinics where few bite cases are reported. To address this, they advise the need to improve stock management and adopting dose-sparing intradermal vaccination, which can assist countries protect more patients with fewer doses. When an animal is bitten, the virus gets into the wound and multiplies before going to the nervous system. This, according to veterinaries, makes it impossible for antibodies and even medicines to penetrate the sheath of the nervous system. Usually with rabies, once symptoms appear, it becomes fatal. However, you can lower your risk of getting rabies by keeping your dogs up to date on rabies vaccine. Other recommended methods is through mass dog vaccination, which is a proven cost-effective way to save human lives by stopping rabies transmission at the source.
Dogs will keep on having babies, and so it's a question of do we have proper dog management I'd say in the country, especially in rural settings.
Whereas a variety of animal species can host rabies, dogs are responsible for 99% of human cases, and therefore eliminating rabies in dogs is key to sustainably prevent human disease. Gloria Milimu, KTN.
Ferdinand Omanya